right now about making peace with Donald Trump, with the president, and yet you went on television 4 times this morning and were asked about it and opined about it repeatedly. You called him a king. You said that his press briefings were like a comedy sketch. Why didn't you just say no comment if you're trying to make peace with him?
No, the first point is he does not have total authority. I mean, I'm a governor of a state. The statement that he has total authority over the states and the nation cannot go uncorrected. I mean, it's just a factual statement that is factually wrong. 10th Amendment to the Constitution. There's a whole body of case law. I mean, there are many things you can debate in the Constitution because they're ambiguous. This is not one of those things that is ambiguous. So that statement cannot stand. And it's not only violative of the Constitution, it's violative to the very concept of democracy. I mean, this was the first battle. Do we want a king or do we want a president? And we opted for a president. So that statement cannot stand, period.
Common attacks, calling him a king, saying that it's like a comedy sketch, saying
no, that's not how it is. His proclamation is that he would be king. That's what a king is. A king has total authority. That statement cannot stand. The whole mutiny on the Bounty, the governors are mutineers, whatever that means, and whatever the rest of the theory was. I'm not going to fight. I'm not going to get into that fight. Look, I bent over backwards. He said a nasty comment about what it was, but he's right. I worked very hard to be in partnership with the federal government this past month. I worked very hard to stay away from politics. And he is right. I did call and say I need federal assistance. I did call and say I need possible overflow beds. That he is right that he did move very quickly to get us Javits and the USNS Comfort. And I said that repeatedly. And I praised him for his actions. And he was right there too. The federal government has a very important role. I was a cabinet secretary. I did it for 8 years. I know how key the federal government is. Frankly, I know how powerful they actually could be in being of assistance. And I don't even think they were as powerful as they could be. And the federal government has tremendous, tremendous capacity that we need now. So yes, he's right on all of that. He's right that we asked for cooperation and assistance. And he's right that he delivered. And I've said that all along. But this mutineers and it can't exist.
Why is the state listing the name of nursing homes and how many COVID cases and fatalities are?
I don't have anything specific to talk to him about today. There's no action item for us to talk about.
Do you think you should talk to him after what's been going on?
I have no, it'd be my pleasure to speak with him, but we don't have anything that is, do we have anything pending? No. I did speak to the White House this morning about a hospital matter. But other than that, we don't have anything immediate.
What was the hospital matter? Nursing homes and how many COVID cases
Have you received any guidance from the president about your role in the reopening? You said yesterday that he hadn't given governors any guidance in their role.
No, we haven't had that conversation. And look, this is a shift in federal position, which is also fine, by the way. We're entering a new phase, the quote-unquote reopening phase. On the first phase, which was the close-down phase, the president took a different tact. The president did not close down the economy. He did do the travel ban with China, and he was right on the travel ban with China. The close down of the economy was left to the governors. And I closed down New York, Governor Pritzker closed down Illinois, Governor Lamont closed down Connecticut, did it different times, different ways, but he he left that responsibility, the closing down of the economy, to the governors. You get to the reopening of the economy, well, the governors closed it down, wouldn't the governors reopen it? The president says, no, I have a different model that I'm envisioning. That's okay too, but it's a shift, but it's okay. But then what is that model? And let's talk about who does what, which is the intelligent conversation we have to have. How do we do this testing? How does that come up to scale? I can't do it. How do we do this technology? And I understand he's right, it raises constitutional questions. And do you really want that cell phone in your pocket to be a tracking device, right? Okay, so let's talk through how we do that. How do we disinfect a public transit system? That has to be understood. How do we have masks for every New Yorker? How do we do that? How do we get 10, 20 million masks so we have that added protection? How do we get gloves? How do we make sure, God forbid, there's a second wave where there's another uptick, that we have the medical equipment we need after we just went through this horrendous hurry-up exercise? By the way, where's the funding for states to help do this? I'm broke. You know, there's no fancy way to say that. We have a $10 billion deficit. Well, the state should do this and do this and do this and do this. I don't have 2 nickels to rub together. And the past federal legislation didn't give us anything. The only thing it gave the states was some Medicaid money. It doesn't give us anything to do any of this. They talked about it in the next package of legislation, if there is one. But that's the intelligent conversation to have.
Will
Now,
Will speak with you about it right now, or will he have this conversation with you?
yeah, I have always had an open line of communication with him. I mean, there have been times in the past when he hasn't been happy with me, and I haven't been throwing bouquets to him, but we've always communicated, and I'm sure we'll communicate now. But I just want to make my position clear. I am not going to fight with him. I don't want, this is no time for any division between the federal government and the state governments. And the governors who I work with, Democrats, Republican governor in Massachusetts, it's not a political conspiracy. Governor Baker's a Republican. This is not about Democratic or Republican. It's just not. This is about New York, 10,000 lives lost. These were not 10,000 Democrats or 10,000 Republicans. These were 10,000 people, period. Forget the darn politics. Everyone's tired with it.
Why is the state releasing the names of nursing homes and how many COVID cases and fatalities are specific homes, like Ohio and Connecticut's doing? Legal experts say that there's no HIPAA issue here.
Okay, you want to speak to that, Dr. Jim?
We put out the nursing home death data by county yesterday, and as you could see, some of them had 1 case. What we're worried about is personal privacy protection, working with the Department of Health. There's there's about 600 nursing homes in the state. This goes for hospitals as well. There's some very small hospitals where they report out 1 or 2 deaths a day. We just want to go through the data and make sure we're not releasing any potential personal information, and as soon as that's done, that will be made available for people. So that's why we put the aggregate numbers out by county. That's what we're going through.
We're getting reports of specific outbreaks at different nursing homes, so it's hard to tell. But you know, are there any nursing homes in particular that the state's seeing a huge problem at?
We're seeing issues like I talked about yesterday in hospitalizations in different parts of the state. We look at total beds being used. We look at deaths. We look at all of that in certain downstate parts of the region. New York City, in the outer boroughs, and Nassau County, we have seen increased cases, but that has gone across the board, whether it be hospitalizations or nursing homes as well. So that's now part of the county data that you do see.
Ms. Hogan.
Yeah, earlier you said that there's been 60,000 cases that you guys have the capacity to do a month. But, so one, is that true? 60,000 a month. But then Mayor de Blasio said that they're going to start being able to do 100,000 tests a week. 50,000 homegrown efforts, 50,000 purchased from an Indiana company. So how does that coordinate with state efforts? And again, is that 60,000 capacity correct?
The signed on the dotted line, what's happening with the testing companies is the same thing that happened with medical equipment, PPE and ventilators. There are just a handful of companies that produce the private tests, and they're all private tests, by the way. A handful of companies that do it, and now every state is going to those companies to buy the tests. I've spoken to the head of the several companies myself, and they have a limited production, and now they have to allocate it to 50 states. And we're again in a bidding war competition with other states. I would say to the federal government, you take that piece. Don't replicate the 50-state pandemonium. You want to talk about an increased federal role? Let FEMA do the testing. FEMA should have, in my opinion, done all the purchasing of the medical equipment, and they should have allocated it. Why am I now competing for private testing capacity and private testing machines with Illinois and California? I want to get out of the eBay competition business for vital medical equipment and now vital testing. I would say to the president, you take it. God bless you. Because you have different bids and different promises from companies to different governments all across the country. Like I bought 17,000 ventilators, and then I didn't get, we only got about 3,000, 2,500. The same thing's going to happen with the testing.
How come the city can get 50,000 made a
Well,
week,
that's
but the
what,
state can't?
well, they're told that from a company. Do I believe we're going to see those numbers actually produced? No, because I think the same thing is going to happen that we just went through for the past month, where those companies are going to get oversubscribed, they're then going to bid up the price, and it's going to go to the highest bidder. We learned this lesson. I saw this movie. I just lived it for the past month. It cost taxpayers tremendous amounts of money. Private companies got very rich. You want to talk about going to a new phase with a different model? Let's inform it from the past model. Tell FEMA, you buy all the tests for the country, allocate them by need. This is where the cases are. New York, your X% of the cases. Illinois, your Y% of the cases. Massachusetts, your Z% of the cases. The federal government is going to buy them, and then the federal government is going to allocate them. Not this, you know, let's give each government or level of government functions that they perform best. And one of the really painful lessons was all this crazy competing by states and cities for medical equipment. We're going to do that again? That makes no sense.
Governor, the accuracy of the serological tests, and what's the plan if those can't get scaled up in the way that you think is needed to reopen?
What is the accuracy, would you say?
It varies. There are many different tests there. We're looking at the tests that have, over 95% accuracy. We are working to scale this up both by our public lab, which is our state lab, the private sector labs that are out there. We're looking at those, as well as the hospitals, which have labs as well.
And how do you address the false positive issue? Because if someone goes back to work, but they don't actually have antibodies like the test says, and then that creates its own problem.
Well, we are looking at that. For example, our state lab, the test that we've developed is basically 6 standard deviations out, which basically means that you're really way up there over the 99% accuracy, if not higher.
But you are right. Can I just follow up? You are right. There are different private sector tests with different accuracy rates. And that's one of the other complications. Go buy tests. Or whose test, which test, what level of accuracy. And that, I think, it's something we have to figure out one way or the other. But I would say that's something the federal government should take.
What's the capacity on that at this point? How many antibody tests can you do? You mentioned a couple of thousand,
Right, so the state, will be by next week at 2,000 tests that we will be able to do per week at that. Right, at that
No,
point.
in a
But-
state of
but-
19 million people, though,
Right, but that's that part, but we're also working with some of the private sector companies to be able to get in the tens of thousands of tests, as well as the hospitals. Several hospitals have developed tests. There are different ways to do these tests. You could do it as a blood test. We are looking at a finger stick test as well, where you just do a little blood spot, and there's technology for that as well.
Yeah, but just follow up on that for a second. Look, you could have a whole symposium on testing. There are two types of tests, the antibody test and the diagnostic test. The antibody test, state health department has a test, and you're right, it's their limited capacity. Let's say they can do, you said 2,000 a day, so let's say 14,000 a week. What is 14,000 a week going to do for you? And by the way, the whole what can the antibody population really be in the scope of things, right? Antibody population, people who had the illness and have recovered. Okay, that's important to know, and we're very aggressive on antibody testing, but how many people are going to test positive, right? What percent of the population at this point do you think had the coronavirus? What could a number be?
20%.
20%, 10%? Okay, you want to find that 10%, 20%, but then that's not enough to restart and get back to normalcy. That diagnostic test is going to be key. And now, think of the volume on that diagnostic test. We're 19 million people. How many diagnostic tests do you want to buy for 19 million people? And then multiply that by the nation. Look at the need. And I'm telling you, you literally have a handful of private sector companies that do this now. Well, how do you scale that up? I don't know. How did you get a rocket ship 220,000 miles back from the moon 50 years ago? But if you could figure that out, you can figure this out. And if the federal government wants to know a valuable role, this is going to be a key element to all of this.
Basically talking about testing everybody for coronavirus in the entire state as a prerequisite to getting the
No, you would never get there. If you said that was the prerequisite, you'd be closed ad infinitum. But you want testing capacity as a tool where businesses can use it as a tool. You want temperature taking, right? You open up a business, they're going to say, I want to take everybody's temperature as they walk in the door. All right, how do you take the temperature of 500 people walking into a business, you know? Just think of all the things you have to do, and then divide it between the federal government and the state government. We have to clean all the buses and all the trains. We want to clean all the park benches. We want to have a disinfectant solution where we have a cleaning protocol that we've never had before. We want the technology to do the tracing once we find the person who is positive, and we can retrace them through the technology. How do we balance that with individual liberties? There's a lot to do here. And the states cannot do this on their own. I'm not shy about capacity. I'm very proud of what we do in the state government. When I tell you I can't do something, it's the first time you've heard me say that since I've been governor. But I'm telling you, we can't do this. Joseph?
Earlier, when this entire thing started 40-some odd days ago, you had said that COVID in a nursing home is like fire through dry grass. It was one of the first areas where there was a complete lockdown. People couldn't come in and out. So why is it that we're seeing hundreds of people dying in nursing homes from COVID? Like, was there lax
You can't,
inspection?
because you cannot stop it, Joseph. You cannot stop it. Look, we have no visitors going to a nursing home. You want to hear, talk about a harsh policy. No visitors, it must be close to a month. You're in a nursing home, you can't get visitors. The staff has to be checked when they come in every day. But by the way, taking somebody's temperature, that's not a foolproof mechanism. And any one of those staff members could be walking in with a spark in their pocket, to torture the metaphor. And that population is so vulnerable, it just takes one staff member who didn't have a temperature, but did have the virus to walk in, and now you're going to have a serious problem. You want to comment on that?
The point that the government just raised is that the crux of all this, that they're individuals with multi-organ system, many other problems, heart problems, diabetes, asthma, respiratory problems. Their immune system is just not as good or as robust, and so they get sick with whether it's this or the flu, and they end up in the hospital. Many of the patients that you had mentioned that's sick and die, a lot of those, they were transferred to the hospital, but at 95 years of age with multiple medical problems, it's a tough battle for them.
Look, Giuseppe, what you've learned is you've learned your strength and your weakness, right? You've learned that you can control the virus, and that's a powerful lesson because we weren't always sure that we could, right? But you've also learned your weakness. You cannot hermetically seal society. You can't hermetically seal a nursing home. You can't put it in a bubble and say, I can protect these vulnerable people. You can't. You can't. Isolation, no visitors, every staff member has to be checked. An ember, one ember, finds its way in, and then it is fire through dry grass.
Governor, in the city of Rochester yesterday.
Residents by making.
Go ahead, Nick.
Governor, in the city of Rochester.
I want to try to get everybody who wants to ask a question to do it.
I also need visual aids. But in the city of Rochester yesterday, there was a 100-person vigil after a shooting there, and it was apparently okayed by the mayor. Is it appropriate to hold large gatherings like that one? Videos online show that people were not likely social distancing during this.
Well, look, I don't know the specifics, and I don't want to comment on the specifics, but we spent a lot of time not only saying there should be no large gatherings, we even said no large gatherings during religious holidays, which a lot of people are unhappy about. But look, that was the first, at least learn the lesson, right? Learn the lesson of New Rochelle. New Rochelle, Westchester. Oh, that's New York City. No, it's not. It's not a dense urban environment. It's in a suburban community. And that was one person in religious gatherings. That could happen anywhere in the country at any given time. So we learned that lesson, and we've been advocating that. I mean, I couldn't be more clear on it. Who didn't ask it? We'll do this, and we'll do, go ahead.
Are your advisors already discussing legal options should the conversations with the White House break down to that point? And what could it mean for the reopening process and the coalition with the other states if that challenge had to survive several layers of appeal and potentially drag on for months?
Yeah, it takes two to tango. It takes two to get into a fight. It takes two people to get into a litigation. I am not interested in fighting with the president. And I can't be more clear in that. I'm not going to allow anything bad to happen to the people I represent, right? I see my job very clearly. I get hired by the people of the state of New York to fight for them and to protect them. I'm trained as a lawyer/advocate. Grew up at the kitchen table with Mario Cuomo, a natural-born lawyer/advocate. I will fight with all my might to protect New Yorkers, but I don't think it comes to that. I do not want to fight with the president. He is wrong on the law. I don't think this is a legal issue. This is no time. You don't even have the luxury for the argument. And there's too much to do for everyone. There's just too much to do. I can't do it. He can't do it. I'm not even sure how quickly we can do it together. So what's the fight about? Go ahead.
That was actually exactly my question, but have you talked to the AG about
Come up
that?
with a new question, fast.
Have you talked to the AG about that at all? About
No.
the
Got to be a better question than that. Go ahead.
Would there be an argument of like state sovereignty, I guess? 'Cause
That
you
would
said-
be the argument.
Yeah, you said
Constitution.
on TV this morning that it would
I'd
be-
call Alexander Hamilton. Thank you, guys.